My name is Galina Vitos. I'm CEO of Digital G Marketing Agency, and today I'm here with Dr. Olga Kharevich, maxillofacial prosthodontist from Cosmetic and Reconstructive Dentistry. And I will speak from 2 points because I am, on one side I'm her patient, and on the other side she is my client because I help her with marketing. But let's go to the interview. First, let me speak from my personal experience with this doctor, what she's done for me. And the first thing I needed, I had a hole in, between my teeth. I needed to put an implant because that was the only solution. So I started searching for a doctor who could do that, and I could see there are so many doctors in the directory, so many prices, but somebody recommended her as a top professional, and this is how I met with her, and I was very, very happy with the result. I'm just saying from my personal experience, the surgery went really well, no complications. The implant adjusted and became a part of my, my bone of body. And so far, I'm really happy with how it turned out. It was very, very precise. And I think this is so important when people are looking for to put dental implants, because it will become a part of your body for the rest of your life. So you need to choose a doctor who will do the right thing, who is trained especially for this procedure, because as far as I know, there are so many offers, but I know for sure not every doctor is equal, especially in this operation. So I wanted to ask today Dr. Olga, please explain what is important to look when you are looking for a doctor who puts dental implants. What is important to look for? What questions should, like if I don't know you, what do I need to look at? What do I need to ask?
Yes, Galina, I think the implant dentistry stepped quite ahead during last decade, and nowadays there are plenty of doctors who do implant placement. I think first of all you need to look at the credentials of the doctor, and if you have complicated case or you need multiple implants, probably my recommendation will be to find a specialist like either periodontist or oral surgeon or prosthodontist who is surgically trained, and look at the credentials and also look at the work of the cases, the pictures of the cases, and you should ask the doctor about the preliminary diagnostic, because basically implant placement is easy, but the planning takes a lot of time. So for the implant to be successful, aesthetically pleasing, and having a stable result for years, it should be done with correct treatment planning. And I don't want to say anything against general dentists, but general dentists usually don't have enough of the training to handle the complicated cases. And why I'm saying about that, because we specialize on on complicated cases, so we see them on the daily basis when the implant failed or they were in the hands of unexperienced doctor, and we need to redo the work to correct the situation, remove the implants from the sinus and so on. So I would say that first of all you need to talk to your doctor about the sequence of the treatment, what will be the anticipated result, and after that you should ask the question about possible complications, and if the doctor will be able to deal with these complications, and as well as correct or do another surgery or if he is restoring the implants, how he will do that. If he's not restoring the implants, how the restorative doctor will deal with the final result. So you will have good, stable, aesthetic crown or bridge or the hybrid prosthesis. So what your treatment will require.
Can I say something? Just based on what you said, like if I am a client, if I am a person who needs to place an implant, what I would do, well, after asking all these questions about complications and restoration after complications, I would say if it was me and I would make evaluation, I would not go to a doctor who would just put an implant and said I'm done, and if you have problems you go to see a specialist. I would prefer to go to a specialist who can handle whatever happens after. Hopefully it goes well, but if there is anything, I would come to the same doctor who has special training to handle the problems if they occur. Is that correct?
Yes, absolutely.
So,
I completely agree with you. Usually, you should think about the implants as a long-term treatment. And in order to be long-term, it should be planned correctly. And also the materials what are used, experience of the doctor, because a simple implant procedure can become a complete disaster if it's done incorrectly in the anterior area. And for example, the people who have high smile line, they will be really upset and devastated.
can I ask you one question?
Yes.
What was the worst, from your experience, when people come to you after they done the implants somewhere else with a not really professional, and they come to you with a disaster? What was the worst disaster you have seen?
I just recently had the case that was the implants were placed about 5 years ago, and the patient had the hybrid, the prosthesis that is attached to these implants, and the patient thought that the bridge, that this prosthesis was loose. So, and actually it was not the prosthesis that was loose, the implants were loose. And I think that in this case, the problem was not even with the implants per se, but with hygiene, because there was plenty of inflammation and separation, and the patient knew that there is the problem with the implants, but basically he put it away, this problem, and didn't go to the dentist for a long time. So we had to remove the implants because they were basically loose in the bone. And now this patient is in the treatment, and it's quite a complicated situation. So, but we hope we will be able to give this patient the fixed prosthesis later on.
Yeah, so the lesson from this, what I see, because I'm watching and learning the same time, I don't know what's going to come out of this. The lesson is, after you put the implants, you really need to take care of your mouth, and I think what you need to check up like every year or something to see
Yes.
if everything is well. Because also don't put it on autopilot and think, okay, I'm done forever. Take care of it, because still implant is like it's a foreign body in your bone. So, and can I ask you also about the quality of the implant? Does it make a difference what you put in, what you put as an implant itself?
It's a very interesting question, a very sensitive topic, because there are about more than 150 different companies in the world producing the implant. So if we had the free resources, we probably can start making our own implants in the garage next door.
Okay, probably some, I don't know, maybe somebody does it because they go like dirt cheap, but let me ask you, just make it easy for you. What company you're personally working with and why you chose that company? Because we will just say about something what is important and why you think the quality is you know, up to the date?
I had a chance to work with different implant companies and different implants, and so far I chose Straumann. It's a Swiss company, and it's very attractive. They're probably the most well-published company in the world, and they have different implants, different sizes, different surfaces of the implant, and they always come up with something new. And what is most attractive out of Straumann is, first of all, is stability of the results and plenty of research supporting these procedures. So basically, why I'm choosing Straumann, because it's not surprising me. I don't expect any surprises during the treatment, because I know that they will help me to get the most stable result.
So just what I hear, the doctor chose this company. You can make a research online on Straumann, you will see the quality, and if you come to Dr. Olga Kharevich, you will know for sure what quality of implant you are getting. That's I think what is important for you to know, as you know, if you are looking for an implant for your mouth. So I think you know, if you go online, it's going to be a good place to go and see for yourself about the quality of the implant. And that's correct. And can I ask you one more question about the how long people should expect the whole process, from starting from diagnosis and until the end? Because I know from my experience how long it takes, but I want doctor to explain what you need to expect.
It depends with the initial conditions. If there is an adequate volume of bone and the site is adequate and the case doesn't require additional procedures, so if the case is straightforward, includes the implant placement, abutment placement and the crown placement, so basically it takes about 3 to 4 months. If the site is not adequate for implant placement and it requires additional procedures, like for example bone grafting, so it can take much longer, because the bone grafting probably itself will take about 3, 4, even 6 months. And if the case does require, for example, additional treatment like moving teeth, like orthodontic involvement or some endodontic treatment, it kind of will take a little bit more time. So, but usually straightforward cases with Straumann implants will take no more than 3-4 months in experienced hands.
Well, yes, in experienced hands. So this is perfect. And is there something else, like any general advice to people who is looking for an implant doctor, an implant dentist?
Yes, sure. I would recommend stop shopping around and just go online and look at the profile of the doctor and reviews about the doctor and his work. So that is probably the best advice that I can give. And just, you know, ask around, because I won't recommend just to go to the doctor because his implants are cheap, because the good implant can't be cheap.
Yes, I totally agree with that. You know, it become a part of your body, and you cannot just price shopping for that, because it's for the rest of your life, and you need to pick something that is really good and you're sure of. So thank you very much, Dr. Olga,
Thank you,
and thank you for all work you've done for me personally. I can highly recommend her because I went through her hands. She has very gentle hands. She's top professional, really well trained. She loves her work. That's what I know, because she loves her work, and she's driven by passion. So that's important. She's not you know, that kind of doctor. Next. She really loves and she will do her best to help you, and she can handle complicated cases, which is not every dentist can do. So thank you very much, and I'll see you next time.
Thank you, Garina.